Today's webinar will build upon our Put Living First webinar that was presented earlier this year on March 28th by RIA's Barb Sutcliffe. Hopefully you were able to join for the live recording or able to watch the recording before joining us this afternoon. Today, Dr. Alan Power, Schlegel Chair in Aging and Dementia Innovation, will help us understand how important it is for those in formal leadership roles in the long-term care community to nurture the process of culture change. The webinar recording and slides will be uploaded to the Ontario CLRI website as a resource, but for now, there is a PDF file of the slides with a place to write notes attached in the handouts box on the right-hand side of your screen, along with the Eden Alternative Warmth Survey for you to use in your own organization. I will be doing a sample of that survey with us later during the webinar. I hope you'll stay with us to the very end of the webinar. We have a survey for you to fill out about your webinar experience, and this is where you'll have the opportunity to request a free copy of the Working Together to Put Living First guidebook with which the Ontario CLRI will mail to residents of Ontario at no cost. I'm just going to introduce myself here. My name is Holly Hebner. I'll be your moderator today. I'm a project coordinator with the Schlegel-UW Research Institute for Aging, and this webinar is brought to you today by the Ontario Centres for Learning, Research and Innovation in Long-Term Care program hosted at the RIA. The RIA is a charitable, not-profit foundation that links research, training, and practice to enhance care and quality of life for older adults. The Ontario CLRI program is funded by the Government of Ontario and is hosted at Baycrest Health Sciences in Toronto, Brer in Ottawa, and the RIA in Waterloo. The program strengthens quality of life and care for those who live and work in long-term care across the province through training, education, and knowledge mobilization. I'd also like to take this opportunity to acknowledge the ancestral and traditional territories of the Indigenous peoples whose land we are fortunate to be on. And we are very excited to have Al here leading this webinar, and I'm going to turn it over to him now.
Thank you very much, Holly, and thank you everybody for being on the call. It's great to be here and to be able to follow up the great call that Barb led earlier on some basics of culture change. I've decided for my first webinar of the 3 I'm giving this year to focus on leadership because we have found that leadership is really key. Even though culture change talks a lot about empowering a lot of our hands-on team members in their day-to-day life and helping them be part of solutions, we realize that the formal leadership has a lot of ability to make or break any culture change initiative. And so I thought that since Barb gave a general overview first time, I would focus a bit on some leadership traits. So what drives culture change? 2 things I like to talk about, and that is wise leadership and commitment to the journey. Culture change is not a 10-step program. It's not a flavor of the month. It's not something that you work on for a few months and then you go on to the next great initiative that's coming along. It really is a different way of doing what you do. It's not an added task. And this is really something that's important for everyone in the organization to understand as we move forward with education about exactly what you are undertaking. We often talk about 3 different types of transformation you may see in organizations: personal transformation, structural transformation, and operational transformation. And I'll just take a moment to explain what those mean to me. Personal transformation, a lot of it is shifting our own views about aging, and as Barb talked about, envision the creation of a caring community by working together to put living first. I think that, as you know, there are a lot of societal stigmas about aging, and they actually inform a lot of what we do in senior care communities without us sometimes even realizing it. So we are certainly going to challenge people throughout the culture change journey to examine our own assumptions and expectations and to really understand whether we are maybe not acting in the best interest of the older adults who are really citizens who are living in our communities. A perfect example of that we see in long-term care across the US and Canada is this sort of default information to family members. We call family members to set up a care plan instead of asking the resident, who do you want at the care plan? Do you want your family member there? We often freely call family members with information about someone's day when maybe it's something that is not earth-shattering or isn't something you would share about anyone else of a different age. I certainly would not call any of your sons or daughters and tell them what you had to eat today and how well you ate and what activities you joined. And so there are a lot of presumptions we make because people are older that deny them their citizenship. So ageism is very pervasive. And without going into great detail there, just a little provocation there to let you know that we have to all look at our assumptions because a lot of our long-term care and retirement systems are based on some of those stigmas. Physical environments, we all know that we want living environments that do not look like institutions or hospitals. We want to support the values of home and support the well-being of all who live or work or visit our communities. And lastly, the one I think is really key is operational transformation, because neither a perfect mindset or a beautiful building is going to work if we don't change the operations to keep us from having a more holistic and inclusive way of doing our work and helping people to live. So that affects many things. And just a few examples I have here. How do we make decisions? Who's at the table when we make decisions? How do we empower different people throughout the community, whether they be residents or staff or family members? How do we communicate information? What ways do we have to communicate? How do we address conflicts? Do we create care partnerships? And it even gets into things like rethinking job descriptions and performance measures. Because once again, if you espouse the fact that you're going to move from a task-based, medically oriented organization to one that focuses on relationships and life, but you are still measuring your staff members at their evaluations on how well they do tasks, then that's what you're going to get because that's what you pay for. And so it's very important that if we are looking at a new culture change journey, we have to look at everything, including how we advertise for jobs and how we evaluate people's performance. And I would just also mention, in case there's anyone from the ministry here, that that also applies to the surveys that are done. If you survey organizations for the tasks and for the biomedical aspects and don't look at relationships, don't look at more holistic approaches to living, then that's what you're going to get too. And so it is important and incumbent upon everybody to shift our focus if we want things to stick, because you basically get what you pay for, whether it be through government reimbursement and ministry surveys, or whether it be through salaries. We have to understand that the motivators need to be there for people to think differently and to act differently. So let's start with the first of those three, personal transformation. I'm going to focus on personal and operational transformation. I'm not going to talk a lot about the building today because you can do culture change in just about any kind of building. And although the physical design is important, I think that that is mostly secondary to the things I'd rather talk about with the time we have today. I've written what I think are 8 areas where leaders can work on personal transformation, and I want to go through each of these in detail, and then we'll have a little bit of time for self-reflection about each of them. The first one on the list is embrace and model values, and I know that we've already gotten some advanced questions about, how do we work with people that don't get it, and how do we change people's minds who are used to doing things the old way. And this is a real struggle that we have, but one of the things that I'm constantly reminded in the culture change instruction I've gone to is that to really ask the question, whom can we change? There's really no one that any of us can change except ourselves. And Socrates said it millennia ago when he said, let him that would move the world first move himself. Or as Gandhi said more recently, we must become the change we want to see. So I think we have to understand that the best way to get other people to change is to embrace those values ourselves and to live them, to model them visibly for people, and then invite people to join it. But we can't force change on anybody. We have to show them a better way, and showing is always better than telling. Another thing I learned in my culture change education was how to take responsibility for how others see me. And I did an exercise over a decade ago in a training session that was quite eye-opening, where they gave us 10 leadership characteristics or qualities, and they asked each of us to privately rate ourselves on a scale of 1 to 10 on how we were with each of these, whether it be vision, whether it be communication, whether it be, whatever aspects of leadership they were. And so we gave ourselves a rating for each one. And then what they asked us to do after the workshop was to go back to work and to share these with coworkers. They could be peers, they could be people who report to us, they could be people we report to, but have them each rate us in those 10 characteristics as well, and look to see how well they line up. And what you often find is that there's a bit of a mismatch. Sometimes you rate yourself well on something where other people don't rate you so well. And I think the normal response to that is to say, well, they don't really understand me. They don't know what I'm all about. But my instructor said, that's not their problem. That's your problem. If you feel that you are doing something and people aren't seeing it, you have to take responsibility for that. You have to find out why that's not visible. Are you misjudging yourself, or is there just something you're not doing so that people don't understand that quality? So it's very important to know that what other people see in us is reality for all intents and purposes. It's not what we think they should see. So we really do have to look into that and take responsibility for it. The second quality would be to be visible and curious, to be accessible to team members, and not just to visit team members when there's an issue or a problem, but to be checking in all the time regularly. One of my earliest mentors talked about getting rid of the open door policy. And the way that she explained that was that she was a director of nursing before she became a culture change specialist. And she used to sit in her office and do her work. And she had an open door policy, which meant her door was open and she would sit there. And if someone had a question and wanted to inconvenience themselves and come down to her, they could come in and they could ask her a question. They might get a look like, what do you want? And when they come in the door. But she realized that that wasn't really what a leadership needs to do to support the team. And so her advice is close the open door, just make sure you're standing on the outside of it so that you are more out where people are than behind a door or even within an open door sitting at a desk. The best way to understand what's going on with your team members is to be with them a good part of the week. It's about being respectful in all communication, regardless of our title, regardless of anyone else's title. And that may sound obvious, but I can walk through organizations all the time and see people treating each other without what I would consider the ideal amount of respect. So it's always worth asking the questions, are we living our values? And ask curious questions of the people that are working in areas maybe that report to you to find out if there are some things you could help with. Why do we do this way? What's difficult in your daily work? How would you do things differently? Or what keeps you from doing things differently? Sometimes the barriers are things that would be fairly simple for leadership to help fix if they even knew what they were, but sometimes we're not even aware. And I heard a story once about a long-term care home where a drop ceiling collapsed. And the reason it collapsed was because the team members were hoarding laundry and sticking it up above the drop ceiling panels. And the reason they were was because the laundry delivery was not happening in a timely enough fashion and quantity to give them what they needed. So they were squirreling some away. And it wasn't until the ceiling collapsed that someone realized that the whole laundry system with respect to the care team needed to be revamped. And so once again, sometimes just asking a question can help us figure out some answers that other people may not be able to solve for themselves. Third one, stimulate people's imaginations. We want to get people engaged in their work. And there's two ways to do it. One is through small picture stimulation and one is through big picture. So small picture is to really look at some of those little discrete processes in the job that might be easily changed to improve the work of team members or to improve the lives of residents or families. And in that case, we're just looking for some small, easy victories, some low-hanging fruit, especially early on in the journey, because at the beginning of the journey, people may be a bit uncertain about whether they want to engage in this or what it's going to entail. So if you give people a chance to see, yeah, I can do this, give some easy victories and show that, yeah, we can do it differently and the sky didn't fall and nothing came crashing down, then you will build confidence and capacity in people to take more chances as you go on. There's also the big picture though. So along the way, we also need to give some inspiring glimpses of what the future is. What's the big picture? Why are we doing this? Where are we going to be 5 years from now or 10 years from now? What will this do for all of us on our journey? And what kind of a world might we be creating in doing these things? I'm reminded of the old story of the guy who's walking by the marble cutters back in Renaissance Italy, who are working in a big open lot, and he asked the first one what he was doing, and he said, well, I'm just cutting these blocks of marble and shaping them to be put together. And he went to the next guy who was doing the exact same job, and he said, what are you doing? And the second one said, I'm building a cathedral. And so there's a different view of what our purpose is. And while we do have to focus on the little tasks, it's good to give people an idea of where this is all going. And it helps people to look up and also to look back at what they've accomplished. I've many times in my journey had people say, oh, I don't think we've really changed much around here. Things haven't changed much. And I've been able to go back 5 or 10 years and, oops, sorry, and just say, well, we don't do this anymore, and we're doing this now, and we're doing this. And sometimes just stopping and celebrating and realizing how much things truly have changed can be very important for people's perspective as well. Next one is collaboration, enabling high involvement in discussions and projects. So trying to get away from the top-down mentality and really bringing people to the table. It could be team members from different areas of the organization, from different job descriptions, and it might even, in many cases, if it affects their lives, include residents and possibly family members sitting at the table as well. And there's no decision too small to ask somebody their opinion, because it really spreads an ethic or a value that this is collaboration, that we want to know what everybody thinks. And so just asking the question, what do you think, can be extremely powerful of other people. If you're not using huddles or learning circles in your organization, these are great culture change tools to start with early. If you don't know the learning circle, basically it's a simple thing that can be done in any meeting, where if you have an issue you want to address, or if you want to check in with people at any point, beginning and somewhere in between, you can just say, let's have a learning circle about this, and you can pose a simple question to the group. And somebody can raise their hand and answer the question. And the key to the learning circle is that when that person answers the question, they are in effect holding the talking stick. Nobody else can talk. Nobody can agree or disagree. No crosstalk, no body language or eye rolling. We have to be completely attentive on what the person is saying. Give them their full opportunity to speak. And then when that person's done speaking, then the person to her right or left can take it up next, and you can follow that direction around the circle. If someone's not ready to speak, they can pass because maybe they haven't formulated their thoughts, but it's up to the person that posed the question or the facilitator to remember who passed and to come back around the second time and give them a second chance. And if you do this and everyone truly has an ability to speak without interruption, you often find that you hear a lot of things that you didn't hear in traditional meetings, because traditional meetings are not level. There are people with more power than others. There are people that tend to be talkers and people that tend to be listeners. And so the talkers talk, the listeners listen, not all the information gets out there. And then of course what happens is you have the meeting after the meeting where people are walking away and somebody's whispering to somebody else, boy, did you hear what Holly said in there? What a dope, she doesn't get it. But none of that is discussed in the meeting because people are afraid to speak up. This is a great leveler. It gives everyone a voice. And what we found in our culture change efforts in my work in Rochester was that people that normally were in positions where they weren't leading, where they weren't speaking up, who tended to be quiet in meetings, over the course of many meetings became much more participatory. They would give their opinions with more confidence, and they would always have good things to say. And it really leveled the playing field for everybody in the room. Huddles are like that. You can just do a stand-up at the beginning of a shift, during a shift handover, maybe with a departmental meeting if you're passing, doing a sign-in in the morning. It's just a great way to once again go around the group and talk about how things are going, check in, or maybe address a little issue among the group and get as many diverse voices as you can. And remember that empowerment is not saying, okay, you're empowered, go do this, or go try it and bring it to me and I'll tell you if it's right or not. It's neither of those things. It's really about what do you need to be successful in taking the lead in a particular activity. And a good way to think about it is that wonderful experience of teaching a teenager to drive, which is hair-raising experience for most parents. But you don't just hand your child the keys and say, okay, you're 16, go drive now, you're empowered. There are many things you have to do. And I talk about 5 different conditions of empowerment. The first one, basic information. So for driving, it might be, how do you turn the car on? How do you operate the controls? What does this do? What do you do in different kinds of weather? Parameters are the rules of the road. And it might sound funny that you have rules or guidelines or limits, but empowerment always has limits. That's how you keep empowerment from becoming chaos. And the people that say empowerment doesn't work have often tried things without giving limits. And when they go wrong, they say, well, they can't be trusted. Well, if you didn't give any limits, speed limits or traffic lights to drivers, it would be chaos too. But those are part of the limits of empowerment. When the light turns red, you have to stop. There's speed limit signs that you should obey. You should change your driving when the weather changes. The third is training and skills. You can read about driving all you want, but until you get behind the wheel of the car, you don't really know how to do it. So it's more than education. It's planning and preparing and then trying things out and learning how to do it. So as you can see, just like teaching a teenager to drive, empowerment is actually very much a hands-on activity for leadership. It's not just giving somebody a decision and walking away. It often means you sit by their side and help them through it a few times. They may need additional resources, and they always need a supportive environment that says, we're going to do this, and we're not going to try empowering, we're going to do it. And if it doesn't work out quite right, then what was missing of these 5 conditions, and how do we do it better next time? If you take something back, a decision from somebody, you will own it forever. So try to do everything you can if you talk empowerment to make sure that you really make it successful. Building trust and self-esteem. How do we build trust? How do we get our team members to trust us and to feel good about themselves? Well, first of all, a great way to build trust is just to do what we say we'll do. And if we don't do what we said we'd do, we shouldn't just assume that people accept that. We should explain why, so that people understand there was a reason why we didn't stay true to our word. To be willing to admit errors. And the best way to earn trust in other people is by giving them trust. The best way to earn respect is by giving respect. Giving honest, timely, positive feedback is very important for self-esteem. And I talk about filling each person's self-esteem vault. And I get that from my friend Jane Verity, who's the head of Dementia Care Australia. And she talks about it with relationship to supporting the self-esteem of people living with dementia, but I think that it works for team members too. So here's how I would quote Jane, that every person has a sort of a bank vault with a certain level of self-esteem inside, like poker chips. And whenever you give praise, respect, or empowerment, you add a few chips to their vault. If you scold or belittle, ignore, or disempower people, then you remove a few. And at the end of the day, end of the month or year, each person is going to be left with a balance of what you have provided or taken away. Why is this important? Well, this is why, because change is very hard. Change cannot occur if team members feel they can't trust you, number one. And change also involves risk, and team members need to feel that you have their backs and will support their efforts even when the going gets tough or when things don't work out quite right. It also involves failing from time to time, and it takes trust and self-esteem to be willing to make mistakes and then get up and dust yourself off and know you've learned something and go forward again. Change can't occur if people don't feel good about themselves or if they feel that they are not valued by other people. So this is some of that advanced work that is very important for leadership. And it may seem fuzzy, but believe me, if you want people to take risks for you, we have got to work on these things. Otherwise, you're going to find that no one's going to take a chance, and they might nod their heads when you suggest something, but behind your back, it's not going to happen. Dr. Murray Bowen talks about the leader's role in calming the system, providing an anchor, because we know that things get crazy sometimes, and someone has to be that person that people can look to for some stability in the midst of all this. And Bowen says that there are 6 characteristics of leaders who are doing this. Number one, we have to be self-aware. We have to understand what our own reaction is to stress. What's our body language? How are we processing what's going on, and then trying to model a sense of stability. We should examine our emotions. When we speak, we should be clear, not fuzzy, but give people clear input and directions so that they feel a sense of stability. Engaging others so that they also have a chance to share their feelings, share what's going on, and be part of the solution. Paying attention to what's going on around you, paying attention to the verbal messages you're getting, but also paying attention to the nonverbal messages. And once again, not only engaging people, but empowering them as well. Number 9 is to promote growth, to treat each initiative as an adventure, seek meaningful challenges for both ourselves and for others. And we should always question the status quo. Is this the way we should be doing it? Is there a way we can do it better? This keeps us moving forward. And there are many tools out there that help people break out of their in-the-box thinking. So if you're struggling over a problem, there are many resources available that can help you to get people thinking in creative ways. One of the people that's been one of my biggest inspirations is Dr. Edward de Bono, D-I-B-O-N-O, who did a lot of work with what he called lateral thinking. or creative thinking, particularly in the 60s and 70s and into the 80s. He's worked with major corporations. He's worked with civic organizations. His work with an organization in New York City was probably where the Neighborhood Watch program started, first in the world. And he has all these little tricks for helping people think outside the box. And I've used many of them in the meetings that I've facilitated. I'm creating high involvement. So once again, people can grow if they can be part of making the change. They have meaning in their lives. They're actually adding to things. They're learning about things, and they are not just being told how the change is going to occur, which doesn't help anybody to grow. Renewing and reinvigorating teams, reinfusing energy and positivity, and to create a tolerance for reasonable risks in order to achieve big rewards. So growth can be done through incremental steps because once again, there is some risk involved. So let's start with a low risk project. Start with things where it's not going to be a disaster, as I said. When you create small wins, there's two things that happen. First of all, you minimize the downside risk if things go wrong, which means people are going to be less fearful, less reluctant to get on board. But also those small operational shifts not only give you a learning curve, but each one of them makes each of us do our job a little bit differently to take on this new initiative. And so if we start with the easy ones, we make all these little subtle shifts in our day and how we work with each other within our departments and within our teams. And by the time we get to the ones that look like really daunting and difficult shifts, we've made so many little things, we've learned so much along the way that they're no longer that difficult. And I use this sometimes in talking about long-term care with the idea of something like maybe a neighborhood trying to get rid of chair or bed alarms if you use those. I worked in an organization that got rid of them, and it was a much better place to work, and the falls went down actually instead of up. But if you got a neighborhood that's got 10 or 12 people who are using chair alarms, you might not just disconnect them and walk away. So what I suggest to people is find somebody whose needs you think are easiest to identify and meet, and just set a goal to help that person be safe without an alarm and help them to have their needs met 80 or 90% of the time. And just work on that for a while. And when you have a modicum of success, then add another person or a couple more. And there may be one person there who you thought could never be safe without an alarm. But by the time you've worked on the people that were easier to understand, you've learned so much and you've made so many little shifts in the way you and your team are responding to people and understanding people that that last person doesn't seem so hard anymore. It's good to give people choices. And remember, there's always more than one right answer to any problem. It's always good to measure results too. And I'm not just saying that because I work with the RIA, but I think that whenever we say we're trying a great new initiative, I think we owe it to ourselves and others to make sure that we are showing to some extent that we're doing what we said we did. It doesn't mean you need a fancy formal research project for everything you do, but you ought to have some way of measuring whether what you said you were going to accomplish really happened. Whether it's just checking in and having a post-mortem discussion with team members after something's launched or with residents, or whether it actually means some sort of a interview or survey with people, you can decide. But it's always good to make sure we're doing what we say. Learning from our mistakes and shifting from a mentality of win versus lose to win and learn. And that means promoting a certain amount of hardiness so people don't get so afraid of not doing things perfectly that they're paralyzed. And I think that our system tends to promote that. We have a system that focuses on tasks and on perfection in a world that's complex and not perfect. And if we don't promote a different kind of world that allows us to live in the gray instead of the black and white, then we can't expect people to join in. Lastly is the positive reinforcement, giving thanks and praise. Finding the good in every effort, regardless of the results, always find something positive. Reflecting on our shared values and acknowledging when they're displayed, complimenting honestly and often. And we always have a rule that if you have some positive reinforcement to give it immediately and in public so that people can see it and they can tie it to what was just shown. If you have some negative critique to give somebody, then do it later and in private because you don't want people to see someone looking like they were belittled. And if you have something to say, you meet them behind closed doors, you explain what you saw, and you give them a little bit of private counseling where they don't need to be embarrassed. So the compliment should be immediate and as public as possible. But also when we thank somebody, another thing I've learned along the way is to not just say thank you for doing this, but to be much more specific. Explain how the person helped you, what it did for you or your life or your job that they did it, what it did for the organization. So people really can tie the thank you to a deeper appreciation of just how they helped you out. And once again, it's possible to have fun on the job, and many studies show that organizations that do find a sense of fun on the job actually are more productive organizations. So never fail to find some joy in the journey, because it can be hard work, as you can imagine. And don't forget to stop and celebrate once in a while. What I'd like to do now is just have a little reflection period. And I'm going to give you 2 questions. I've taken those 8 categories. We only have 5 voting categories. So I've put them in, I've grouped them into 5 groups. So the first 2 are embrace and model values or be visible and curious. Second one, stimulate people's imaginations. Third, collaborate. Fourth, building trust and self-esteem or providing an anchor. And the last is promoting growth or share thanks and praise. Now, I'd like you to look at those 8 qualities and choose one area that you think is a particular area of strength for you as a leader. I'd just like you to give us a quick vote and check the box, and we'll see where people think their strengths are overall today. As you can see, Kate has put the box up there. We've got well over 130 people on, so we'll get a nice spread of ideas probably.
All right, we'll give everyone a few more seconds.
Just go with your gut. Doesn't have to be perfect.
All right, thanks for participating, everyone.
And here's what we got. We got the biggest one is helping build trust and self-esteem or providing an anchor. So a lot of strength there. A fair amount of strength in embracing a model of values, being visible and curious, promoting growth, or sharing thanks and praise. Lower ones are with collaboration and stimulating imagination. So these may be areas where we need to think a little bit more. But what I'm going to do, we'll take that down, and I'm going to go to my next slide. And I'm actually going to ask you to rate yourselves now in the other direction. Choose one of those practices where you feel yourself you need to grow. I don't know if it'll line up with that or whether you'll choose something different if you didn't choose the box the first time. But once again, vote for one area that you think is an area of need for personal growth for you as a leader. And let's just see how these come out.
All right, a few more seconds. And thank you, everyone, for being introspective. It's not always easy to be honest about our weaknesses and the areas we need to improve on.
And the results show that, just as we expected, the highest one was the one that was lowest on the first one. Stimulating imaginations is tough. It's funny that not a lot of people pick collaboration as their number one, but they also didn't pick it as their biggest weakness either. Really, it seems like stimulating imagination and looking at the big picture is where people are at. So that's good food for thought. One thing I'll mention is that if you are on this call with team members, or if you want to share these 8 qualities with team members later and ask this question, you might find that other people that you work with have strengths in areas where you don't, and vice versa. So sometimes the best way to get further tutelage in these areas is to pair up with somebody who has complementary strengths and challenges, and see if you can help each other to grow in those areas. Okay, well, thank you very much for doing that. And now I'm going to go to this area of operational transformation. And these are 5 areas I'm going to talk about for operational transformation before we close. So I'll just go through them in detail. First of all, culture and climate are different things. Culture is, we kind of talked about that, I'm sure, with Barb's call, the prevailing attitudes and beliefs and practices of any group of people. There's a culture in your organization. There may be a culture among the nurses or among the social workers, or a culture among salaried employees. There's many different cultures. There may be cultures related to people's personal culture too. Climate is a different thing. Climate is the underlying values that drive people's actions. And this is a concept I get from my work with the Eden Alternative. And Eden Alternative often equates growing an organization to growing a garden, and says that you need a warm climate for gardens to grow. And so they look at 3 axes of climate. Is it the organization generally full of people who are feeling generous versus feeling stingy? People who are generally optimistic versus pessimistic, and people who are generally trusting versus people who are more cynical. And it's important to know that while culture can occur in many different areas of an organization, the climate is largely determined by the modeling of the people who are the formal leaders. And that's why this is an important topic for all of us to think about. What Eden Alternative did was they developed warmth surveys to measure this. And these are not satisfaction surveys, they're not quality indicators, but they are just snapshots of your organization's current climate as experienced by either residents, family members, or team members. So I'm going to give an example of how we used some soil warming to warm the climate at St. John's Home in Rochester, where I worked before we joined the Eden Alternative formally. To join the Eden Alternative, you need to have a leadership vote, among other things. You need to have some decent surveys and a board approval and resident council and other things. But one of the things you have to do is the leadership, formal leadership has to vote, and you need to have a 100% commitment of leadership to try it. Um, Now we had a CEO at the time who was very interested in doing this, and I think that around the table, everybody who was in formal leadership probably would have voted yes just to please him, and to not be the stick in the mud that's saying I don't want to do this. But I'm not sure that people were 100% agreed with doing that. And our mentor that came in and worked with our leadership team recognized that, and she was not going to let anybody vote when the team was not as fully functional as they should be. So she started a process, and the leadership team had, it was a big home. It had 12 or 15 people that met twice a month for a couple of hours. And so she took a meeting and she had people just describe what she thought were the attitudes and behaviors of the people in that room. And she said, if this were described as a garden and the soil in the garden, what would the temperature be? Would this be, 25 degrees and balmy, or would it be zero with icicles forming? And to write that anonymously on an index card, as well as the things you see that support whether you think it's a warm or a cold climate. And she collected them all and she started posting them on a flip chart, and people got to laugh or celebrate the things they did well. And she listed them on one flip chart, and another one she listed the behaviors or attitudes that she thought were opportunities for the team to grow and to be less dysfunctional. And then the team had to commit to take one of their 2 monthly meetings to work on each meeting one of those areas of growth. And so they spent probably the better part of 6 months working on these team dysfunctions among themselves, because she knew that if there was discord and dysfunction in that formal leadership, that to take on a big change among the hands-on team members was doomed to failure. Because how can you undergo this big change when you haven't got stability and proper collaboration among the formal leaders? So they did that, and they were able to be more open. They were able to not use index cards, but to speak openly. They actually worked on a lot of the dysfunctions in the team, and they were much more feeling unified. And then when the vote did come, it was much more honest. And we even had people putting things on the vote like, I'm still not sure about this. I'm still skeptical. I still am worried about this or that, but I think it's worth trying. I don't like what we're doing now, and I'm willing to give it a try. So people weren't just, nodding their heads and saying, yeah, Charlie, we'll do it, and then turning around and sabotaging the process. So it was a very important way that we looked at our climate and did some dedicated work to improve it before we moved forward. And so, when you're anxious to do culture change, sometimes these things seem like, oh God, I want to get started, but you have a better chance of success if you really go through this due diligence. So I'm going to we're going to focus on the team members warm survey, and I've got some more things for you. And I'm going to give you 5 questions from the team members warm survey, and I want you to try as honestly as possible to tell us what you think your team members would say. Not what you want them to say, but what you think they would say. So, for example, the first question: my work has meaning and purpose. Scaled from 1, very little meaning and purpose in my work, to 5, very high. 1, 2, 3, 4, 5. Where do you think most of your team members, or what do you think the average of your team members would fall out on that question? If you just put a number in there. And once again, we'll see where people think um, their their employees are at as far as meaningful work at this point in time.
Okay, we'll give everyone a few more seconds.
And the results show that most people think that it's pretty meaningful. That's good. So we're between 3 and 4 for the majority, and a lot of 5s and very little 1s and 2s. So right now, I think we feel that people feel that their job is meaningful, and that's nice to see. Let's go on to the next one. This one is going to have a reverse scale because it's a negatively worded question. I regularly hear coworkers make negative remarks about other employees. Do you find this happens a lot or a little? A little would be a high score, 5. If it happens a lot, it would be 1, or somewhere in between. So what number do you think your coworkers would say about this, about making negative comments about other coworkers? And this one comes out with maybe a little bit farther down. We're seeing some more negativity here than maybe we'd like to see. So that's an area that, once again, this warmth survey would trigger for us where we could try to work on that. Going on to number 3. This once again is a positive question. I have an opportunity to grow in my job. How much opportunity to grow do you think your team members have? From 1 is low to 5 is high. And once again, there's 35 or 40 questions. I'm just giving you a sample of 5 so you can get an idea of what kinds of things this survey looks at. Okay, a few more seconds. Put your best guess and we'll see where they come out. And we get on this one in the middle. We have a few more that have opportunities to grow, but we have about a quarter of people who are in the low area. And, the 3 is kind of indeterminate. So really the majority, not sure. And that's not uncommon for people to feel like a job is what it is. And there may not be, unless you become a different job, like you go from a PSW to being a nurse, that you can't really grow. So that's an interesting challenge for us. Number 4, another negative question. I spend too much time in unnecessary activities. 1 would be a lot of the time, 5 would be rarely or never, or somewhere in between. How much do you think your team members would say they spend in unnecessary activities? Remember, look at that. Always is 1, and rarely or never is 5. Okay, let's wrap that up in a few seconds. And once again, in the middle, we see a few, but it looks like the we're more toward not being too bad with that. But there certainly is a significant percentage that have got some issues with that. Okay, last one. I can trust the people I work with to lend me a hand if I need it. 1 is low, 5 is high. Let's do one more poll with this one. And what do you think your team members would say today? Let's give it 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And the majority said yes, it's a trusting environment. That's really good. And as you can tell, that's one of the trust versus cynicism questions. Now, what Eden does with this tool is that if you're an Eden Alternative member, they will give you a free analysis and give you some suggestions if you're low on trust or low on generosity for how you can do some things to improve it in your organization. If you don't belong to Eden, you can certainly use the survey and you probably can figure out from the questions where things stand. Um, and I don't know if they have the bandwidth to analyze surveys from non-Eden homes for pay or not, but I wanted to show this to you because this is a different way to look at your organization than simple satisfaction surveys, I think, and it gives you some new clues. A couple of things to do before we finish. One, as you'll hear in my fall webinars, I talk about using a well-being framework for supporting people living with dementia. And I'm just going to preview that by saying that this is really important for everybody, whether it be identity, connectedness, security, autonomy, meaning, growth, and joy. These are 7 life-giving needs that exist with everybody, independent of age, culture, nationality, or whether we are a resident or a team member or a leader or a family member. We need to support these in everybody. So this is a large part of what we do in leadership too. We'll spend more time on that in the fall. So what is frost? Well, Eden says that if you have a garden, then frost is inevitable. And we know in Canada you may have a nice bountiful garden, but something's going to happen around November where all of a sudden things are going to get frosted over. And it's inevitable. And the garden dies back, but it comes back in the spring. Frost never kills a garden. It kills the upper parts, the harvest, but it doesn't kill the garden. It just is a reminder that change does consume warmth. It takes energy and time and effort to go through change. And if we're going to have steady culture change, we need to steadily infuse warmth and warm values into the community. And you may need to pause at times. You may need to stop and help build those leadership values that we talked about at the beginning to give people better trust and self-esteem after a lot of hard work. And of course, life happens. There's so many things as you can see there that can stall your culture change journey, and those are inevitable. I remember Eden founder Bill Thomas saying, if the culture change process doesn't make you fall to your knees and cry once in a while, you're probably not really doing it. But frost doesn't kill the garden, and it doesn't kill a culture change journey. The only thing does is when the gardener or the leader walks away from it and gives up. That's what kills it. So it's just a matter of getting by this. So how do we get by frost? Well, first of all, we debrief. We listen to everyone talk about what happened and how things got derailed, being humbled by this and realizing what hard work this is and how complex it is, and forgiving others for any shortcomings, forgiving ourselves too, reaffirming our values, warming the climate, and recommitting to the journey and moving forward again, because this is hard work. And you may try something, and then after several months something will happen and you might backslide, but the interesting thing is that you never quite backslide to where you started. You're always a little bit ahead, and you've always got a little bit more of a foundation for moving forward. Very quickly, Everett Rogers believes that everybody's in a different place on whether or not they're willing to or ready to innovate, and that there are a few people up front, those innovators, the 2.5% that are camping outside the Apple store before the product is released, even though they've never seen it or tried it before. And then there are early adopters who are also willing to be fairly innovative, maybe not quite as fanatical as the little group, but about 15% are really willing to jump on when they hear a good idea. There's another big group, about a third of people, who are probably going to come on board, but they just want to sit back and hear a little bit more about it. They want more information. They want to make sure they don't, not the first ones to put their heads on the chopping block, but they're probably fairly easy to convince. The next third is a group of people who are going to be tougher to convince. They're going to be naturally skeptical. They've seen other things come and go, and they'll sort of say, I believe it when I see it. And it may take a little bit more work. And then there's a group of people who may be very difficult to convince or change, and some of them may never change. And I think it's important when we talk about staff turnover that low staff turnover is good, but the ideal staff turnover is not really zero, because there's some people that, as Jim Collins would say, are not on the right bus for what they want to do. And part of what culture change does is it identifies the people who have got what it takes to follow you on the journey, and it usually identifies a few people who have not got what it takes, and they will often move on to another place that's not doing this. What I found, though, is even though we lost people and were upset to lose people along the journey, they were pretty much always replaced by somebody else who came to us and applied for the job because they heard what we were doing and were excited about it. And so that always moved us to a better place. The interesting thing is that Rogers says that all you need is about 10 to 25% of that curve to embrace a new idea to reach a tipping point. You don't have to convince every single person or even the majority of people. So he says, spend your energy not on the people that are difficult to convince, but preach to the choir. Get yourself some cheerleaders and a coalition of believers who will help you. Be your reinforcements to help you educate, sometimes to help you spread the word, and also sometimes through peer education. Because maybe a PSW isn't going to listen to me as a doctor saying what we should do, because she doesn't believe I understand her life and her career. And to a certain extent, she's absolutely right. But if there's a PSW who gets it, who can help me do the education and explain to a peer, that makes a big difference sometimes. And remember that our readiness for change also evolves. I'm going to share one more curve that we used at St. John's Home, and that is a culture and a readiness for change curve. So people are usually at 5 stages of readiness when you bring a new idea. There's awareness, understanding, acceptance, commitment, and ownership. What awareness means is, yeah, I've heard about this concept. I really don't know anything about it. I've just heard the words, but I can't tell you whether I like it or not. Understanding is, okay, I've been to some education sessions. I guess I understand a little bit more about it. I'm still not sure if I like it, but at least I know something about what's going on. Acceptance is a little bit farther. Okay, I've seen how this might benefit me or the organization. I'm accepting. I know we're going to go this way, and I will try not to sabotage it, and I will go along and do my best. The next level is commitment. I not only understand it and accept it, but I'm actually committed. I'm going to help you. Just tell me what you want me to do, and I will help you with the change. And the last one, the ideal one, of course, is ownership. And that is, you don't even have to tell me what to do. I'm going to take it upon myself to drive this with my own energy and my own ideas. So there's some lessons about this, and I'll go back and forth. The first lesson is that everyone sits at one point on the curve at any given time with any initiative you bring forth. And nobody is a good or bad person. That's just where they happen to be right now. People don't generally jump stages. They tend to go one stage at a time. So going back, they're not going to jump from awareness to commitment. They tend to move through stages. And it's good to assess where each person or which each group of people is on this curve because different people need different things to move them up the curve. So for example, sorry, I keep going the wrong way. If you're at awareness, but you don't have understanding, what you need is some basic education, information seminars, pamphlets, Q&As, whatever. If you're at understanding, but you don't have acceptance, then you might need a little bit more about what's in it for me. How's the organization going to benefit? How am I going to benefit? So with each of these, you can see what you need to do to move the group farther along the curve. And once again, I'll bring a story from St. John's. We were working with neighborhood teams before the formal neighborhood team process was developed. We had a much rougher one that we were just trying to do without a lot of format, and we were trying to get people from diverse departments to come meet on the neighborhoods and have regular team meetings, and we weren't getting much attendance. The team members who were on the neighborhood weren't always making it, and particularly the ones from other departments were just not breaking away, and we just couldn't figure out why this was not getting any traction. So we had a big leadership meeting, and this was all leaders and middle managers, and once again, in a huge organization like ours, that was 40 or 50 people sitting in the room, and so I led people in an exercise with this curve, and I gave them each an index card, and I said, okay, awareness is 1, up to ownership is number 5, and I'd like you to confidentially just vote on yourself. When you hear about neighborhood teams, where are you at with this concept of neighborhood teams? And I also had people just not put their names, but say how long they'd been in their job. And what we found was that the average was just barely above 3. And there were lots of people that were still 3, 2, and even some 1s. And so it was no surprise why neighborhood teams were taking hold because the managers and the leaders hadn't accepted it or understood it or were committed to it themselves. So of course they're not giving the message to their employees that this is important to be part of it. So we realized we had work to do with leadership once again. You have to do work in the leadership levels before you can expect everybody else to embrace these things. And interestingly, of course, the people that were the lowest were not the people that were brand new to the organization. They were often many people who had been there for many years. So that's all I wanted to formally present. We're going to have a little time for questions. I just would suggest you take home a personal reflection, and that is what's one key learning point that you'd like to work on to strengthen your role as a leader and improve the well-being of all those. And it might be long-term care, it might be retirement, wherever you work. I think these apply to leadership throughout an organization. And I'm going to leave you with a quote from one of my favorite quotes on culture change, which I took from an Italian novel called The Leopard by Giuseppe de Lampedusa. I just love this quote, and that is, if we want things to stay as they are, then things will have to change. And I'll leave it to you to try to figure out what the heck that means. So thanks everybody for being on, and we have some time left over. I think probably about 10 minutes for any questions or comments. So I will let Holly tell us how she wants to do that.
Thanks very much, Al. So as Al said, we do have some time for questions, about 7 minutes. If you can type those questions into the questions box on the right-hand side of your screen, I will read them aloud and hear from Al. Nothing's coming in just yet, but we'll give it a few minutes here.
I know that's a lot of stuff I kind of threw out there quickly, and you might need some time to process. You can always send your questions on, I'm sure, Holly, later, and we can always try to get some answers and get back to you as well.
Yes,
It takes some time
absolutely.
to process all this, or if you want to bounce something off others. But once again, feel free to share this recording with your team members, talk about it, share best practices, and see where you're doing well and where you think you might want to put more effort in.
All right, so we just had one question come in here, and they'd like you to expand a little bit more on the last graph you presented, Al.
Okay, let me just run back a little bit. Okay, yeah, once again, you're going to have people all over the map. So let's just, I don't know, pick an initiative. Let's just say, I'm in a long-term care home and we're using alarms and we want to get rid of alarms because they're noisy and they scare people and make them startle and fall. And that's my rationale, but everybody may not agree with that. So once again, when you look at the team members who are actually supporting those residents, you may find quite a mix. You might find some people that say, well, I know a little bit about the alarms, but I don't really understand what they're talking about here. I think with most team members, they're going to be above that level because they use them all the time in this case. But people may understand it, but they might say, you know, I don't really know that I agree with that. I'm afraid people are going to fall and get hurt more often if I take away the alarms. I don't think that that is a good idea. I need more information. So you might need to present more information about the data out there that shows what happens to falls and shows how alarms can be safely discontinued. And then you might get some acceptance, but people still might be a little uncertain or might be able to say, well, I'll give it a try, but I'm still skeptical. So once again, you may need to do some of the things I said. Start with a couple people that are easy, get those easy wins, show people that you can keep somebody safe without the alarm and that the sky doesn't fall. And then they're going to be more committed. And then once they do 3 or 4 and they start to get a sense of self-confidence and how to do this, how to read people better, how to understand their needs, how to adjust our rhythms to meet their needs so that they aren't trying to get up constantly without assistance, do those things that are driving their need to get up proactively, so that people can be active when they want to be and then will rest when they need to rest. Then you might take ownership and you might say, okay, well, that worked really well. Mary's, I don't think Mary needs her alarm anymore. I'm going to work with her and see what I can do. So once again, this is helping move people along the way, because it's the people at the upper end of the curve, of course, who are going to be your reinforcements. They're going to drive change. They're going to come up with new ideas. And so we want to have as many people above the acceptance level as possible. It just builds momentum. It's a lot of people talk about culture change as sort of a flywheel effect, like the flywheel on an engine. It takes some energy to start turning it, but once it does, then the energy just keeps building, and this kind of like a domino effect where once you start it, it gets better and better. So I hope that gives a little bit more information about that.
All right, thanks, Al. And the next question we have is, do you have any resources you might suggest for someone who is new to a management role?
There are a lot of great books out there. So first of all, I would definitely suggest that you get the CLRI book on culture change that Holly talked about at the beginning of the session, because it really is a good step-by-step guide to healthcare organizations. There are many people outside the healthcare field that write about this too. And boy, there's so many. Some of them focus on different aspects of leadership. Jim Collins has been famous with his Good to Great series. There's a guy named Daniel Pink that does a lot of great stuff. Simon Sinek, who talks about the why behind what we do, is really good. One person who kind of challenged the traditional leadership approaches, who I've always liked, is Marcus Buckingham. And I think his first book was called First Break All the Rules, where he talks about how you really want to work on people's strengths and not on their weaknesses. So it's sort of an appreciative approach. Oh God, there's a million out there that I've read. There's a good book on servant leadership, whose author I can't remember at the moment, but I think the servant leadership concept is a really good one to understand as well. There's going to be many more, but there's a lot of good stuff out there. And I don't know, Holly, if CLRI has a resource list of good resources for this, or whether maybe in the back of the culture change notebook there might be some resources as well.
Yes, we can certainly look at that. Someone did ask how did they get their hands on that Putting Living First, creating a culture of living guidebook that we'll be mailing out. Once you close the webinar, a survey should pop up, and there's a place for you to put your mailing address, and that we can send that to you for free as long as you are a resident of Ontario. And another question here. A lot of people ask, how do you start? And they're wondering how you would you suggest adopting a certain model of care first and using that as your guide?
It depends on who you are. I think there are certainly some models out there. I did a lot of work with Eden Alternative, which is the largest single culture change philosophy in the world, but there are many others. I've worked with the Greenhouse Project, which combines operations with design, and I'm working with them right now. One good thing to do is, and it's coming up in just a couple of weeks, is go to the Pioneer Network, which is a U.S. organization, but they have a lot of Canadian participation. They have a culture change conference every year, and it's happening August 4th through 7th down in Kentucky. at pioneernetwork.net. You can read about that. And if you can't make it this year, every August, they have a conference where they bring best practices from all over the continent and get together with lots of great talks. Eden Alternative has a conference every 2 years, which is open to anyone, whether you belong to them or not. And the next one is going to be early May in 2020. And you can go to edenalt.org and find out about that. And then, of course, RIA and Canada has a culture change conference called Walk With Me, which happens every 2 years. First one was in Edmonton in 16. Last one was last year in Niagara Falls. And there's going to be one in 2020. And do either of you know where it's going to be in 2020?
I believe it's being held out west. I'm not entirely sure where exactly,
Yeah.
But it is not in Ontario this or next year. It will be out west.
Yeah. But you might look into some of those organizations and hear about their philosophy. There is an Eastern Canada and Western Canada representatives for Eden Alternative. If you want to find out more about those, you can find them and their contact information on the website. Sometimes the best thing to do, and one of the things we did at St. John's, was just to go back and to meet with all the team members just in small focus groups, maybe 10 or 12 people on all shifts, and just sit down and say, what do you like about this place? What would you do to make it better? And just start getting dialogue right from the beginning and hearing what challenges people and finding out what they would like to do and do a little visioning. And that might drive you in the direction you need to go as well.
All right, thanks, Al. And we do have some friends from Capital Care who are chiming in saying that the next Walk With Me conference will be held in Calgary in 2021.
Thanks. And I just met with a couple of Capital Care folks in Calgary last week, as a matter of fact. So I'm glad to hear that you're on the call. They're doing some great things out there. Calgary is really a very progressive town when it comes to culture change. And I was just out there all last week doing some consulting, and I'm very impressed with what's happening in that part of the world.
Okay, great. Well, we are past the 1 o'clock mark, and I know everyone has busy schedules, so I don't want to take up any more time from anyone. So I think we'll wrap up here. I would like to say if you do have further questions for Al, you can always email myself, and I can direct those to Al. And I want to thank everyone for participating in the webinar with us this afternoon. And thank you so much for Al for spending the hour with us discussing leadership's role in culture change. And just a reminder, Al did mention he will be doing 2 more webinars with us. It'll be a series of 2 titled, How Do We Apply Culture Change When Caring for People Living with Dementia? Registration is open for both of those webinars on the Ontario CLRI website, which you will see listed on the screen. There are some other ways you can connect with the Ontario CLRI as well, social media. We do have a 1-800 number, and there is a general email that you can use to contact us as well. And we will be putting the recording up on our website in about a week's time, along with the handout from today. And yes, thanks very much, everyone, and I hope you all have a lovely afternoon.
Thank you, everybody.